Hello and welcome everyone to another episode of Talk with the Doc with our own Dr. Akil Taher. If you don't know him, let me just take a moment and tell you he's a practicing physician, family physician. He's an author, a heart disease survivor, and he corrects me on this. He says, I'm a heart disease thriver, and truly he is. He's transformed personal challenges into opportunities for growth and advocacy. And if you don't know and haven't read his book, at age 61, after undergoing open heart bypass surgery due to a high stress, highly active yet unhealthy lifestyle, high cholesterol, and something he recently found out, an elevated lipoprotein A, he embraced heart healthy lifestyle changes, including a whole food plant based diet, exercise, sleep, managing stress, abstaining from alcohol, conscious connections, spiritual growth, and through appropriate medications to successfully control his cholesterol levels. And he continues to thrive today and brings to us his heart and his soul and his passion around sharing a message of living a heart healthy lifestyle. And so, with that, thank you everyone for joining us. I could talk more about the marathons and the 100-mile bike rides, Mount Kalish and Kilimanjaro, but I'm going to allow him to get started now and share this valuable information around anemia and how we can solve the iron puzzle. So, Dr. Keel, the floor is yours.
Okay. My idea today was to speak about anemia. It is a very common condition, but I will not be speaking generally at all with all ages. I'm going to speak anemia in the aging population. That means 60 and above. This is where anemia is most likely to happen. And it is a very common condition and it is associated with different health problems. I would like to acknowledge Dr. Leslie Carnison. She's a geriatric doctor who has done a lot of work on anemia, and a lot of things are taken from her talks and her expertise. So, what I was saying is that anemia can be a diagnosis and it can be a symptom of a health problem. More likely than not, it is a symptom of something happening in the body, a disease or a health problem in the body. And there are many forms of anemia. The most common in the US are the iron deficiency anemia, vitamin B12, and folate. There are others which are anemia of the chronic diseases, anemia of cancers like leukemia, or your sickle cell anemia, your thalassemia, which I'll touch on. But the most common misunderstanding in the US that most people think that it is iron deficiency anemia, mismanaged by health personnel too. So if you have anemia, you go to a doctor's office sometimes, not all times, but in some cases I've seen, oh, you got anemia. Why don't you take some iron? And they put you on iron tablets. Remember, one of the most common problems older people have is constipation. And if you are on iron pills, it increases this constipation. So unless and unless it is proven beyond doubt, without a doubt, that you got iron deficiency anemia, you should not be taking iron. That's the first gold nugget that I want to give it to you. That first, be certain with your doctor that it is iron deficiency anemia. Now, as I said before, It is a problem of not what anemia is a problem of not having enough healthy red blood cells or hemoglobin to carry oxygen to the body's tissues. That means if you have a problem with the red blood cells or the hemoglobin, the oxygen will not be carried to the tissues and you start getting symptoms. Now, the hemoglobin is a protein found in the red cells that carries the oxygen from the lungs to the other organs. Now, having anemia can cause sometimes with mild anemia, no symptoms. With moderate anemia, you can get tiredness, weakness, shortness of breath. And as I said before, there are many forms. Now, anemia can be short term or long term. It can be range from mild to severe, and it can be a warning sign of a serious illness. So, how do we start detecting anemia? I guarantee you that if you've been to your doctor, everyone on this show, including myself, or been to the ER, or been to a specialist, they have done a complete blood count, CBC, or an urgent care. They do the CBC. It's important for you to understand CBC because you get a CBC, you don't know, you ask your doctor, I need to have my CBC. A complete blood count has what? First of all, it has got white blood cells. And it shows you how much white blood cells you have because it fights infection. Then you have the red blood cells, which carry, as we say, oxygen along with the hemoglobin. And that hemoglobin contains iron. Then you have that hemoglobin that is there, which is also shown with the hematocrit. They go hand in hand. Then you have the MCV, if you look at your CBC. That is a mean corpuscular volume, meaning that the size of your blood cells. Because in iron deficiency anemia, you get microcytic. Your RBCs, red blood cells, are small, while in vitamin B12, you get large ones. And sometimes you can have both B12 and iron deficiency, in which your blood cells will be normal. And finally, if you see the CBC report, I wish I had one to show you. Anyway, platelets, you have platelets, which are important in the importance in clotting. So these are the things that you have on the CBC. Now, sometimes labs differ. There may be a little change in the numbers here and there. Uh, so this, first of all, we start off anemia with the detection, and that is with the CBC count. So the next one is which we talked about. Now, anemia occurs when the blood doesn't have enough hemoglobin or does not have enough red cells. This can happen if your body does not make enough hemoglobin or red blood cells, or there is bleeding, which causes loss of red blood cells and hemoglobin faster than it can be replaced. See, the body replaces red blood cells. We'll talk about it. Or the body destroys red blood cells and the hemoglobin that's in them. So either it is destruction, or it is bleeding, or body does not make enough red blood cells. So that all these three causes can lead to less oxygen being delivered from the lungs to the different cells in your body. And so you start getting symptoms. So we said the CBC is required. Now, how bad is the anemia? See, the normal level of hemoglobin, don't worry about the hematocrit, worry about the hemoglobin. Normal levels of hemoglobin are 14 to 17 grams per deciliter for men and 12 to 15 grams per deciliter for women. Now, if you have something in men, say 13.5, 13, you may not, you may not have any symptoms. If you got something like going down, say 10 grams, 10.5, that means now you are having moderate anemia. And your severe anemia is when you go down to 6.5 to 7.9. Just forget these numbers, but remember one thing. Between 7 and 8, you will require blood transfusion, except in some rare cases, which I will talk about it, which you don't require. But if you got 7, and I've seen so many times cases with 7, and we have to 7, 7.5, we had to transfuse the patient. So in that cases, because in moderate anemia and other anemias that you have, you blood transfusion, the it may give you a band-aid treatment, but you have to find the cause. Okay, so remember 14 to 17, 12 to 15 in women, and the blood transfusion is between 7 and 8. Symptoms of anemia. You see, once you don't have enough oxygen in your tissues, you start feeling tired. You start feeling weak, shortness of breath. Your heart rate increases because now your heart has to do more work to give that oxygen to the different tissues. You start getting a headache. Now, the signs that show, sometimes you may even get chest pain if it's severe anemia, and cold hands and feet, dizziness or lightheadedness. A very simple thing to do is, even in your own selves, go over to a mirror, pull down your lower eyelid, and see the conjunctiva that is there. That should be nice and pink. If it is pale, that means there is a possibility of having anemia. Then look at the hands. See, this is more so in white people than in others. Uh, so if you look at over here, see this. This is a yellowish, pale hand as opposed to a nice hand over here. And if you have very severe anemia, your blood pressure can go down, like in accidents when you lose blood. All right. Now, the symptoms of anemia depend on what? What was your level of hemoglobin? Like mild anemia may not have any symptoms. Body compensates to a degree with low hemoglobin or adapts to that. It takes weeks to months to develop any symptoms. And sometimes the body adapts. But if there is a quick drop, if the drop is sudden, say from 12 to 10 in women, then you have more symptoms. Now, let me explain that in cases where you have, let me explain that way back when I was a medical student, we used to have a lot of worm infestations in India, like hookworm. Now, this hookworm infestation would draw blood from the intestines, but it was very slow. It was slow, so slow, it was like 1 cc to 2 cc's milliliters of blood that was being sucked out from the intestine. And so these people adapted. So what happened is when they came to see me, they were not in a condition of severe symptoms. And I would find hemoglobin 8, 7.5, and they're carrying on their usual lives. They have symptoms, but then it is not really remarkable symptoms which you have here in America at 7 because somebody has lost, because you can't have, generally speaking, you don't have so many of worm infestations over here. So if you got a slow bleeding somewhere in your body, then your body can adapt to this. So basic thing to remember is how quickly your hemoglobin drops. If it's a sudden drop, these are the questions. Finally, we'll cover what questions you should ask your doctor. That'll be in later on. So, so to understand this, we got to understand the life cycle of a normal red blood cell that is in your body. Now, generally speaking, the red blood cell lifespan is 100 to 120 days. That means about 3 to 4 months. Now, once the RBC dies after that, the body recovers iron in the hemoglobin and reuses it to make new red blood cells in the bone marrow. Now, in the bone marrow, it takes 7 days for the body to produce this red blood cells in that marrow. And therefore, this iron which is there when your RBC dies is recycled in the body. So, two important things. Lifespan is 100 to 120 days of an RBC. To make RBC in the bone marrow is 7 days. So, what happens when something interferes with this normal life cycle that we talked about? One is what goes wrong, symptoms of an underlying health condition, and that needs to be treated. There can be problems in production of red blood cells or losing red blood cells, or in some cases, both. Now, let's talk about production. Causes of anemia that affect production. It means production of your red blood cells. See, iron deficiency anemia can, because it affects the production if you're iron deficient. If you're vitamin B12 and folate deficient, production is not there. If you got chronic inflammation, chronic diseases like thyroid disease and other chronic diseases, you can get that the production is not enough for the body. Then you can have chemotherapy. See, chemotherapy attacks dividing cells, so it also attacks your red blood cells. So again, the production is not there. There can be bone marrow disorders. There can be bacterial or viral infections, leukemia, lymphoma, aplastic anemia. That means all RBC, WBC, platelet, everything goes down. This can affect the bone marrow. And finally, a chronic diseases like chronic renal disease, kidney disease. Why? What happens over here? If you have a chronic kidney disease, your erythropoietin in the kidneys, which we call EPO, stimulates the bone marrow to make more red blood cells. And now it cannot be stimulated. Your bone marrow cannot be stimulated. And that is why you find that athletes take this at times, erythropoietin, to increase their red blood cells, to get more oxygen, especially at higher altitudes. Sometimes in my mountain climbing that I've done, Kilimanjaro and Kailash, I've seen people who walk along with me have taken erythropoietin so that they have larger RBC and more capacity to take in oxygen at a higher altitude. I was tempted too, but no, I didn't take it. So that is regarding your erythropoietin and the production that affect the production of red blood cells. Now, let's talk about anemia due to blood loss. Fatal injuries. car accidents, road accidents. You can see the blood. Somebody getting shot, there's blood. And therefore, this is an acute lowering of red blood cells and your hemoglobin. But remember, you can have a blunt injury and you can have internal bleeding that does not show. So that can also cause your hemoglobin to go down. Bleeding in the GI tract, very common in the US in terms of anemia. You're talking about, not otherwise very common. But in anemia, this is one of the very common things whereby you are bleeding in the GI tract because it can be the bleeding in the stomach, the small intestine, or the colon. Remember, daily aspirin use, NSAIDs, like ibuprofen is on over the counter. People take it like candy. This can cause bleeding. People who are on blood thinners, people who have got ulcers, slow bleeding. Now, the last thing is heavy menstrual periods, which does not happen in older people, but I mention this because it is one of the very common cause in young women. So these are the causes of, in fact, when I was a resident over here, I remember one of my colleagues or somebody who gave a lecture once said that if you have a low hemoglobin and your over a period of time, say you're 40, 50 years old and suddenly you get your CBC and your hemoglobin is less. Say if you're a lady, it is say 9. Then it is most likely, not saying always, to be a cancer of the GI tract, cancer of the colon, especially until proven otherwise. So remember that if you have got suddenly, you're healthy, everything is going on good, but your hemoglobin has gone down, you must suspect cancer of the colon and you should get tested. Okay, we jump on to. So what we came to a conclusion was that they did the study. Uh, the anemia caused in older adults, one third is due to deficiency of vitamin B12 and or folate. This caused the anemia because of deficiency of B12 and folate. One third are due to chronic inflammation or chronic kidney disease or chronic inflammation. That I already said that I think it's a repeat here. One third can be any other cause. So, and remember one thing, older adults can have more than one cause. The other causes can be hemolytic anemia, sickle cell anemia, thalassemia, a large number of anemias that are present. So, how do we test? So, once you go to your clinic, your doctor, your primary care doctor, and he does a CBC, and you have a low hemoglobin, please, you got to repeat this. I've seen so many times lab errors, especially if you got, say, for example, again, in women, it's 12. So say if it is 9.6, suddenly, please ask your doctor to retest it. It's important. So once you get that, then you need to do is your peripheral smear, not you, that the lab should do a peripheral smear. Because most likely, if you're thinking of iron deficiency or B12, then that peripheral smear, which you look under the microscope and the doctor sees it is a small RBC that points to iron deficiency, a large RBC points to vitamin B12. Now remember, Vitamin B12 deficiency is one of the things very common in vegans and vegetarians. We do not have vitamin B12. It was there in the soils when there were no pesticide or insecticide used. But now, with those things being used, vitamin B12 is not being made by the bacteria. So, we need to emphasize and tell people, vegetarians and vegans, to please take the vitamin B12. I've seen a lot of cases when vegetarians have come to me and B12 is less. Now you wonder, okay, B12. No, B12 has significant uh, action on your nervous system. You can get that combined degeneration of the spinal cord. All these things can happen if your vitamin B12 level goes really, really low. And then what you do is they calculate your reticulocyte count. These are the brand new blood cells that has just come out of the bone marrow. If it is low, it can suggest a red cell production issue. And then you carry on with the blood smear, the reticulocyte, checking for inflammation markers. That's another thing is very important. If you've got inflammation in your body, then you have to check your C-reactive protein and your erythrocyte sedimentation rate. Don't worry about what this does, but at least you should be knowing that if inflammation is there, your CRP and ASR will go sky high. Okay, next comes is treating anemia. When doctors don't find a cause, either they're not tried hard enough or they've tried and they don't know what it is, then they depend on transfusing the patient. Uh, Double-blinded studies, a lot of studies have come out, research has come out that transfusing mild to moderate anemia usually does not improve outcomes. Now, if you've got iron deficiency anemia, treatment for this form of anemia, if it is mild and moderate and it is not bleeding, then you should be thinking about your diet. If the diet does not help, then the iron supplements can do the trick. If the cause of iron deficiency is loss of blood, finding the source of the bleeding and stopping it is absolutely essential. That may involve surgery. So again, vitamin B12, supplements, and increasing the nutrients in your diet. Again, one more thing I want to tell you. I've seen quite a large number of patients who have had vitamin B12 and the vitamin B12 was not coming up. Why? Because they had what is called as pernicious anemia. Their mucosal lining could not absorb vitamin B12. And these people need to get their shots. At first, the shots every day because you have to get the vitamin B12 up. And then in time, the shots should be just a month, but it is for life for pernicious anemia. Now, anemia of chronic disease, it depends uh, if symptoms are very severe at transfusions, and you can even use erythropoietin if your doctor suggests that. Now, anemia is associated with bone marrow disease, can include medicines, chemotherapy, bone marrow from a donor transplanted, and then in aplastic anemia, you may require blood transfusion. And your hemolytic anemias are such that where the red blood cells are destroyed faster than the body can replace them. Sickle cell anemia. This is an inherited hemolytic anemia where red blood cells become sickle shaped and hard. So they can't go through the blood vessel. They block the blood flow and break down early. Less than 3 months, a month. So you get severe pain. I used to see this a lot when I was in Bahrain. There's a certain Arab this thing which have very high uh, sickle cell. Over here, the blacks also have high this thing of sickle cell anemia. Then you have thalassemia. This is abnormal hemoglobin leading to very fragile red blood cells, and you can get into chronic anemia. And this can be triggered off by taking certain things like sulfur drugs that can trigger this off. So, this is in short overall anemia. This thing, some of these do not apply to older people. Now, so what to ask your doctor about anemia? First of all, you got to, how severe is my anemia? Doc, is it mild, moderate, or severe? Number two, how long have I had this anemia? Is it stable or is it getting worse? Is this a cause of my symptoms or something else may be causing it? Are any of my medications, take the list. Is this involved? Are any of my medicines causing bleeding, like your aspirin or NSAIDs? What is the plan, doc, for treating this? And what is your plan for further evaluation? And when do we check the CBC again? This is very important that you keep that CBC in your records because it is useful if you're seeing a new doctor, if you need to go to the emergency room, or to see a specialist. But these are the questions you have to ask. Iron deficiency anemia can be, as we said, slow blood loss, aspirin, blood thinners, antiplatelet therapy like Plavix after stents, ulcers, and bowel cancers. Now, be sure to ask your doctor the cause of your iron deficiency. What could be the cause? And if he puts you on iron, that doctor should check your serum ferritin. Put it down before iron supplements are used. Because if you do not require iron, you can get into um, hemochromatosis, which is excess iron in your body and can be harmful. And remember, as I said before, most iron supplements can cause constipation in older adults. Caveat over here, not all anemias involves iron deficiency. Okay, so we recap what we have just talked. Anemia means lower than normal red blood cell count. You follow your hemoglobin and hematocrit on a CBC, most likely a hemoglobin. Anemia is common in older adults and often has multiple underlying causes, as we have talked about. Anemia is a diagnosis and a symptom. Anemia is often mild to moderate and can be chronic. If you are diagnosed with anemia or see a low hemoglobin lab report, ask the following questions. Is my anemia chronic or new? Is it moderate or severe? What is the cause? Have you been checked for low iron and low vitamin B12? If iron supplements are recommended, did they do a ferritin level or otherwise confirm low levels? And now comes my pet subject. I always find people wondering about heme versus non-heme iron. Remember, heme iron is found in meats or meat-based products. Now, they say, if you ask people, lay people, oh, you're on a plant-based diet, I'm sure you're suffering from iron deficiency anemia. Not so. It is heme iron that is found in the meats can be a pro-oxidant. It oxidizes cholesterol and free radicals likely to cause strokes, heart disease, diabetes, and also can cause cancers. This is apart from the fact that it has got no fiber, has got high saturated fat and cholesterol. This is your heme iron. So, heme iron, I agree when people tell me that heme iron is better absorbed than non heme iron, which is in plant based foods. But look at the safety. And I'll tell you exactly how to get that non heme iron absorbed so that it is even more absorbed than heme iron. So remember that heme iron, as far as I'm concerned, is a total no. Now, non heme iron, it has more fiber, it has got more magnesium, it has got A, vitamin A, C, E, and it is found in whole grain cereals and breads, dried beans, legumes, dark green leafy vegetables, bok choy, spinach, kale, dried fruits, nuts and seeds, pumpkin seeds. There's a lot of non-heme iron. Your sunflower seeds, your cashew nuts, your pistachios. Now, if you want the non-heme iron, you're already absorbing if you have a plant-based diet. But if you feel that it is not being absorbed, just take organic acids, vitamin C, or citric fruits, oranges, grapes, things like this. This can absorb your non-heme iron, in fact, much more in some cases than absorption from heme iron, absorption of heme iron. And so with that, I would stress once again, be careful. Don't go in for heme irons. There's a lot of danger to it. Try your non-heme iron. Ask all the right questions to your doctors, what I've told you. And if they cannot answer, then find the answers somewhere else. Okay? With that, I'm going to stop share and we will take some questions. All right.
Awesome. Wow. That was so great. Thank you, Dr. Akil. If you'd like to unmute and turn on your camera and ask any questions or um, add any words of wisdom from your own experience, we are here for you.
Yeah, so he mentioned blood thinners as being a danger, and I have been taking a lot of Chinese herbs, and one of them I know particularly Actually, it's a combination of herbs, but it's a packet that's called Quinery. And I noticed that it does thin my blood. So I'm just wondering, do I need to take precautions with these Chinese herbs? They are food grade.
Not at all.
No?
Not at
Okay.
all. No. I don't think that this should make a difference. But now suddenly, if you find your hemoglobin is going down and you ruled out all the other things, bleeding and the things that we talked about, if you ruled all that out, then you should give up the Chinese herbs for a while and see how it is going. But otherwise, I don't think you should.
Okay.
Even,
Okay.
even I don't tell people who are on antiplatelet therapy to stop that. I'm only saying if you're on antiplatelet therapy, especially after stents for a year or what have you, or if you're on an aspirin for atrial fibrillation, then do not stop that. But you find that your hemoglobin is going down, then think about it and
Okay.
tell your doctor.
Okay. I have another question if you have time.
Oh, I have all the time in the world.
Okay. Okay. So you mentioned the importance of vitamin B12, and I do take it as a supplement. Um, I was wondering, is vitamin B12 something similar to the DHEA that vegans do not get from fish? Is it a similar problem that we need to supplement it in somehow?
Yes. Yes, yes. For example, if you do not get the DHEA we are talking about, and then you can get it from certain other things like flax seeds or chia seeds, you can get those. But in terms of what you are talking about, yes. Your second question was what? I'm sorry, I
Well, when I'm mentoring people who want to be vegan, there's for me, there's always the caution of the DHEA and the vitamin B12 that they may not be getting.
abs- B12
Right.
is a must. Is absolutely a must.
Yeah.
Unless you're growing unless you're sure your soil has never been tampered
Mm.
with pesticides or insecticides and you're growing your own and you're getting your own vegetables, then there's a possibility of the bacteria making the vitamin B12. But in today's day and age, I'm sorry, you have to take a vitamin B12.
Okay. Okay. And then would you get your DHEA? If
I
you
personally believe it can come from your chia seeds, your flax seeds, your moringa powder, your amla. I, I, I believe these are the things, but other than that, I'll have to look into it.
Okay. Okay. Thank you. Thank you. Okay.
Not at
Very
all,
helpful.
Janet. It is such a
Thank
lovely.
you.
Thank you for
Thank
your
you.
question.
Thank you.
Hello, Sunny. How are you? You are muted. Have you got them muted?
Trying. There we go. There we go.
All,
I'm
all good.
sorry, I didn't see your whole presentation. I had a computer problem, so um,
That's it.
I don't come with questions, but I met you at Rochelle Wilder's group that you spoke to, and so I wanted to keep up with you.
Great, great.
So
Lovely having you, my dear.
thanks for
Uh,
this.
Not at all, not at all. And what you missed is if you feel like, you can always hear the recording.
I will listen. Thanks.
Dr. Akil, I have a question. I
Mhm.
like to know, I don't consume a lot of salt, but let's say that sometimes you have some powder that you have to add to your salads or your food and has a lot of salt. Will that cause a problem for iron?
I don't think so. Salt would not be able to cause any problems of iron, but salt could be a problem in terms of retention of fluid and getting your blood pressure high. But that's a different problem. And I'm surprised that I don't know about in Canada, but here we have the FDA says 2.5 grams. The average American has 4 grams of salt per day, and I say it should not be more than 1 gram. So and that could be, but not for this thing. Only thing that I've noticed is that in terms of, again, coming back to the subject of heme and non-heme iron, that your absorption of heme and non-heme iron is so much better if you have certain citric fruits along with it.
Thank you. Thank you.
To your point about iron absorption, are there foods that we may be eating in our vegan lifestyle that can block iron absorption?
Good question. Uh, no. In fact, most of the fruits and vegetables help in the iron absorption. Uh, I'm not too sure about a very heavy fiber diet.
Mm.
Say you're taking 100 grams of fiber a
Yeah.
day. I am not too sure about that. But other than that, no.
So what
Yeah.
about green tea? Can you have green tea and not absorbed by the iron?
I don't know if there is any studies, at least I don't know. There may have been studies, but about green tea not helping or helping absorption of iron, I don't know. But I think you can have green tea.
Hmm.
There's so many good
Yeah.
uh, things about green tea that I don't think you should give up. There should be other reasons why your why your iron may be low, not because of green tea.
Does it cause any oxalate in your kidneys, the
Uh,
green
uh,
tea?
what can cause oxalates?
The green tea.
I don't think so. You can get oxalate stones if you have certain kind of fruits and all that, but not otherwise.
Okay.
Those oxalates are also stones that are not, they're radiolucent, so they can't be seen on X-rays.
Mm.
You do an intravenous pylography where you have a deficiency in the meal that is being drawn in, that radio opaque thing, that you will have a deficiency in there. That is how we see that there has been possibly an oxalate stone. But oxalate stones are not radio opaque.
Okay. So spinach is very high in iron, right?
Good
Yes,
source.
Spinach, yes. But it's also high with oxalic
excellent.
acid. Is that correct?
Yes, yes.
So does the oxalic acid in spinach prevent some of the absorption of the iron?
No,
No.
no. Because spinach itself has got so much iron.
Okay.
It
Okay.
has no this thing on absorption of iron at all.
Okay. And does it make a difference whether it's raw spinach or cooked spinach?
Uh, not really. I like to have my spinach partially cooked, just slightly. Unlike the lycopenes in tomatoes, they say you have to cook tomatoes to get the lycopene absorption better than raw tomatoes. But in
Yes.
spinach, no.
Either way. Okay. Okay. Would you say the spinach and perhaps the kale is the highest form of food
Yeah, bok
for
choy,
iron
your bok choy has a lot of
and
iron.
bok choy?
So
Okay.
these are the ones which I look into, And when I make my morning, it's not a juice, it's the kind of thing that I make. And in my Vitamix, I found out that it is better to use frozen veggies than actually getting it fresh. Because the fresh is possibly, I'm in Atlanta, something has come from Peru, but
Mm.
flash frozen veggies have much more nutrients than the others.
Okay.
So
Thank you.
I get it from Costco, which are frozen, flash
Uh-huh.
frozen, and organic.
Okay. Thank you.
Yes.
Very helpful. Thank you.
I have one more question, Dr. Akil. When you go and do research in AI, can we trust what they say? Because I just did a bok choy to see if it's oxalate, and it says no, not at all. Spinach is, kale is, but not bok choy. So I like to know where to look in order to get the right information.
Yeah, you see, you should be very careful about AI. AI is a great friend, but it can be an equally bad enemy.
Okay.
So remember that. It gives you a general idea of what it does. It goes into the whole system and finds out the best answers. Not best answers, the maximum amount of answers. So if there are, say in doctors, if there is something coming out, say there are 20% quacks who have written a lot of things on AI, but real doctors have not written much, then it'll shoot and give you that 20 quacks who have done. That this is what is true
Thank you.
because they have their MD. So I'm not saying all of them are quacks or anything. I'm not trying to. All I'm saying is in every profession you will have these. People who are not good, people who are good. But if people are not good, put a lot of things on internet, put a lot of things, then AI catches those. Have you ever noticed in AI when I use AI and I try to uh, ask a question which is totally uh, anti to what it has told me, but I say that look, I think this has worked for me. It'll come immediately and say, "Oh yeah, yeah, that's a very good thing, and it has worked for so many people." So take it with a grain of salt.
Great. Thank you. Thank you so much, Dr. Akil.
It's not like I said, it's a great friend. I love this sessions, whether there's one person or when I go out and talk to hundreds. It's a question that keeps me going, because I learn so much. I go
I
back
have,
and I do.
I have
So,
a question. I have a
yes,
question. Yeah, I wanted to ask you about vitamin B12. I know that there are some that you take that you put under your tongue. Dr. Furman has vitamins that have the B12 in them, and you just take them like a regular capsule. Is there any difference, do you know, about the ones that you absorb under your tongue or the ones that you take in a capsule? For some reason, I think I remember that it's not absorbed as well or something, but I'm not sure on that.
it depends on your vitamin B12 levels. If they're
Okay.
very, very low, then you can put it under the tongue because sublingual absorption is faster than
Ah,
going to the
okay.
intestine. But
Okay.
if you are got a mild vitamin B12, then
Mhm.
you might as well take the capsules.
Okay. All right. Good. Good. Thank you.
So I have a question. Um, there were a couple of terms that were being used that I personally, actually, it was the first time that I've heard of them. But you mentioned asking the doctor about this. One was ferritin, and the other, you and Aaron were just talking about it. The word started with an A. And can you just explain what those two things are?
See, ferritin is the iron content in your body. It actually figures out the way how much of iron your body has. Now, I've seen so many cases where people have come with iron when they have not had iron deficiency anemia. And when I do the ferritins are way up. So that can cause hemochromatosis that I talked about. more iron in the body that can go into the heart, muscles, and all that and cause problems. Now, on the other hand, the other side of the coin is that a lot of people who come around with not showing hemoglobin is very low, but when I do the ferritins are extremely low.
Mm.
So now I know that there is iron deficiency. Now I'm trying to figure out why.
Yeah.
Mm,
Then you go on to the next step that we discussed. Is it the production? Is it the bleeding?
hmm
So then you go on to that. But I've seen people with very, very low ferritins or people with a very high ferritin, and they've been taking it for years. That's why I
So,
always say when you are taking iron, you can't just be taking iron for life. You have to get it checked every so often, 3 to 4 months, 6 months. What is my, it's a CBC.
Yeah.
so I remember seeing on reports, the hemoglobin numbers, but I've not heard anybody ever mention anything about ferritin, which is another level as you're explaining it. So we should be asking the doctor
Absolutely.
what our ferritin levels are.
Say, I'm a patient. Tomorrow I go to my doctor and I've been put on iron for the last 2, 3 years. Even now, I would ask, Doc, have you done my ferritin levels? And see what he has to say. See, when you have ammunition, when you know, we have discussed this. I have had patients who asked me this, and I have to reply to this. Your doctor should reply to this, like in LP little a. I mean, I'm going to do a talk on LP little a with Rip Esselstyn shortly. And his secretary wrote to me, I think I told you, Lynn, that when she got me the date to talk with him, uh, she said that it's such a burning topic. I went to my doctor yesterday and I told him that I want my LP little a. And the doctor said, what is that?
Mm. Wow.
So there's only 1% of the people in the US have got their LP little a tested, and it is only 1.2% of the doctors who test it.
Mm. Wow.
Yet there's 1 in 5 people.
1 in 5 have this. That is 20% of the population is a high LP little a. Number one. Number two, in the blacks of African descent, it is 1 in 4.
Mm.
No, 1 in 3. And in South Asians like me, it is 1 in 4. That is 25%. And in the blacks, it is 33%. And just think of it. The test is now free. FDA approves it. Some centers even give you money to test it. But even if you have to pay, it costs like half a tank of gas. And you do it only once. It's because it's genetic. It's negative, you're home free. It's positive, then we have got ways to deal with it. So why should you not get it done?
Yeah.
hmm
I got it done at the age of 76 and I was positive. So what do I do next? I immediately get everybody. It's called a cascade testing. Right of me, left of me, front of me, back of me. My father, my mother, if they were alive, my siblings, my children. My daughter was very high. So with these things that come up, actually, I feel that it's things that not only science and evidence backed, but I've had the journey where if you now count my heart, and it's doing very well, but it has got a Wolff Parkinson White syndrome, the conduction defect, it has got an LP little a high, it has got stents in it, it has got bypass surgery.
And
You're a
you're
walking
still going
textbook.
strong.
Yeah.
Yes, Sunny, go ahead.
About LP little a. my doctor, my cardiologist told me shortly after we met that he knew I had genetically high cholesterol because of my readings. And that was probably 10 years ago. And I've taken statins. And I think if I told him now I want LP little a tested, he would say, well, what are you going to do differently?
I'll tell you, I'll tell you what to tell him.
Okay.
Okay? You tell him this. My cholesterol is not coming down with the statins. It's
Except it
not.
does, except mine does.
Your does come down with statins already? Okay.
Yeah.
Then you have a little problem. But if your cholesterol was not coming down, then you should have asked him to get you the CSK9 inhibitors. That is Repatha short. The Repatha short can decrease by 20 to 30% your LP little a. Number one. Number two, you tell him this. Then why would I not go on Repatha shots? I don't want to take statins because statins can slightly increase your LP little a.
No kidding.
Yes.
Mm.
So if I can go on Repatha shots, we will kill two birds, not kill, to save two birds with one stone. But,
Yes.
to-
Thank you.
because you can also get your cholesterol down to levels that you never dreamt of
Mhm.
with the Repatha shot.
I
Plus you get your LP little a done. Because if you got a heart disease or if you got a high cholesterol at a very young age, like familial hypercholesterolemia, then you should be on Repatha.
Wow.
Yeah.
Even if your cholesterol numbers are lowered with statins, because statins are not good for you.
Statins have problems when you get it. The idea is that FDA will not approve of it. That's a different thing because that is why it is such an odd thing that I'm talking about this in the fashion that I am. That sometimes I feel that people who have a high LP little a should have a high cholesterol because then the FDA allows Repatha shots.
Hmm.
But if you got a high LP little a with no high cholesterol, which can happen, FDA does not allow Repatha. So I was lucky because I've got both cholesterol very high and LP little a very high.
Mm.
Mine has come down. My LP little a has come down.
No.
And I believe that partly because of the whole food plant based and partly because of the Repatha.
Is it hard to give yourself the injection?
Not at all. Not at all. It's in the thigh, just once in 2 weeks. It's just like a insect bite.
Yeah.
And that's all.
Well,
It's all over.
I'd at least like to have it ILP little a tested.
Yeah, you should tell him. Why would you not get it tested? When was your high cholesterol? You were young?
Fairly young.
Then you should ask him.
Okay.
So that is one of the criteria to ask. If you got premature heart disease or strokes or aortic stenosis, if you have got a very high cholesterol which is not coming down, if you are of a black African descent, if you are a South Asian, if you're menopause, that's the only time your LP little a increases compared to your male counterparts. So if you're menopause and you believe that you have high cholesterol, ask your doctor to get an LPA done, even if it was done when you were, of course, no LP little a was done 20 years back.
Thank you.
And if they say that it's not covered by insurance, know that there are still ways for you to get the test done
Yes.
for free. And you can reach out to Dr. Akil and we'll make sure that you have that information. When we put up this video, I'll make sure that the link is in the description so that you can find it there as well.
Mm.
Good. Thank you so much. And I don't know with LP little a when I do it with RIP in February, can everybody join in?
If I'm not mistaken, it's going to be pre-recorded,
Okay.
and then he releases it shortly after you record it.
I've done one with what's his name?
With
Chuck.
Rip.
No, Rip I'm doing in February, but I've done with Chuck.
Oh,
Yes,
Chuck
yes,
Carroll.
LP Lloyd is on the physicians committee exam room podcast list.
mhm.
So if you go
Listen
there,
to
you
that
can
Chuck
find it.
Carroll. That is also what I've done on LP Little A.
Mhm.
I'm
And
really after this.
and you did one that maybe is in the archives, right? For LP little a.
Yeah, I've done one with Lynn.
Yep, it's
Yes, yes, uh-huh.
on the website. Thank you for that,
Mhm.
Jan.
Yeah,
Yeah.
sure.
Okay, so we shall.
So my other question, the other word, I can't remember the name.
Oxalate, oxalate
Oxalate. Okay.
with an
What is,
O. It's with an O,
oh, not
oxalate.
an A. Yes. What is that? Oxalate.
See, these are things found in vegetables and fruits that they say sometimes can cause problems in your clotting and other things. Uh, I don't believe in that.
Mm.
I believe a whole food plant-based diet is the way to go. And unless there is certain direct evidence that this is happening to you because of this, you should be worried about it. The main thing is, as far as I know, I've seen several patients who had oxalate stones. Not calcium, but oxalate stone. That's all. Otherwise, not really. I think this one had a question in here. Janet had a question.
Yes.
Yes.
I'm wondering where that.
Is the risk of blood clotting less if we are vegan?
Uh,
Especially if you get some surgery.
I, yeah. The problem with the clotting is that if you have a certain situation like having an high LP little a or high cholesterol, these things have more clotting factors. And I believe that plant-based foods, in my opinion, do not have any as such clotting factors of dangerous things. I have not seen anybody with a whole food plant-based diet has to stop it because of prevention of causing clotting or not clotting.
Okay.
I don't. I believe that the whole, the point I'm making is that the dietary guidelines that came around, you all know about the dietary guidelines
Yeah.
that have come around now. Uh, the minute good thing about the dietary guidelines is that they're asking you to have whole food as opposed to processed and ultra processed foods. That's great. But then you can't say that you have whole milk. You
Mhm.
can't say have raw milk.
Yeah.
See, that's the whole point I'm making. You can't say that it's better to have a piece of a chunk of beef as opposed to processed meat because it is as bad. I mean, your processed meat is worse than your this thing, but the chunk of beef that you are having, even though it is freshly cut or whatever, has a lot of problems. You cannot say that saturated fat is allowed. You cannot say butter is allowed. You cannot say tallow is allowed, which is nothing but lard. You cannot.
Mm-hmm.
And this is why when I wrote, I wrote a very nice piece on LinkedIn, my thoughts on the dietary guidelines. And one of the readers told me, and I partially agree with him. He wrote to me that these are not guidelines for health. These are the guidelines by dairy industry and the meat industry.
Mm-hmm. Mm-hmm.
Yes,
Yeah.
It's true.
Mm-hmm.
It's true.
Yeah.
it's true. Yeah.
But so what can you do? But you have to be it has gone back into schools. The children are getting whole milk now.
Mm, yeah.
So
But one
whatever
of the good things
supplies,
is, just let me interject one thing, because one of the good things is, while they are offering whole milk in schools again, they have allowed alternative milks to also be served, but the kids have to ask for them. And some schools may decide they don't want to do that. So while we've made progress, they've kind of tied one hand behind our backs with that happening. And then we're still pushing for the option to get whole food, plant-based foods in schools, K through 12. And some schools are more open than others, but we know that it's the leadership. It's those who understand this that are willing to step up and say, yeah, this is for our kids. Let's do this. But yeah, to your point, there's more that needs to be done.
I mean, it's like throwing a few things here and there, the scraps, like sugar. I agree with that. He says not to have sugar. Fair enough. That's a good point. Process, good point. Don't have. Ultra process, don't have. But when you turn around and say then that saturated fat is good, butter is good, that makes me that
Hmm.
you're taken such a long time to move a step forward. Now you're on three steps backwards.
Yeah.
Agreed. Even where they said that those who are on SNAP, getting SNAP benefits, whether you're children or older and you're getting these SNAP benefits, they will no longer cover you getting sugary drinks and ultra processed sugared cereals and things of that nature, which for the longest they had been pushing.
Correct.
But now they're pushing the more expensive things. And so you're going to have kids not drinking the sugary stuff, but then they'll be drinking whole milk. And what have you done? And adults and seniors who are getting SNAP benefits that don't understand the differences. They'll stop drinking their colas or whatever, their sugary drinks, but then they'll be saying, well, maybe milk is good for me. I'll start drinking milk again. Um, it's insane.
Yeah, it's totally insane. Totally insane. But in any case, um, yeah, we got to keep fighting. That's what all we got to do.
Hmm.
It may not happen in my lifetime, but who knows?
Yeah.
At least we tried.
Yeah.
That's all we
Now,
can.
Dr. Akil, do most people who are recognizing they may have an iron deficiency doing it because they feel a lack of energy versus some other symptom?
See, this is what I'm trying to say, that iron deficiency anemia is common. So if a busy doctor will say, take iron, but it is not done to find out whether it is iron deficiency. Now, there are a lot of physiological effects and other things make you say, oh, I got the iron shot, or I got the iron, I'm feeling better. But it's not true. You have to, you definitely need iron if you need, but first try and give it a shot with plant-based iron foods.
Yes, and I don't know about you, but I love spinach.
Yeah.
My tofu scrambles with spinach, my um, mushroom. Um, what did you make on the last Shop and Cook with the doc?
Oh, we made a spinach, a mushroom, uh, and it was what was it called? And it had
Is it
cauliflower,
hollandaise,
Florentine,
portobello,
portobello
Florentine?
Florentine.
Yeah.
I
With
use,
spinach.
I use exotic words so that people can go on my site and find a very ordinary dish. Okay.
Well, It was so good.
It was
I
very
made some.
good.
Mm-hmm.
My greatest hardest critic is my daughter.
Mm.
So when I gave it to her, she says, "Oh my God, that was scrumptious." So
Oh, good.
you gotta do that. But I wish I'd made that sauce that we made of the cauliflower, the Florentine. I wish I had done it a little differently by putting a little cashew nuts in it,
Mm-hmm.
so it becomes nice and soft. But
Yeah.
as I said, I'm learning.
Creamier. Mm-hmm.
Okay,
Mm-hmm.
Jen, lovely seeing you. Sunny,
Thank
lovely
you.
seeing you. Erin, you may not be there. Oh, you are there.
Thank
Okay,
you.
thank
The
you. Thank you
memory
so
Thank
much.
went
you.
down. That's why I had to disable myself. The memory of
Okay.
my PC.
Yeah.
No,
But
no,
thank you so much, Dr. Akil. Thank
no,
you.
no.
Yes.
Thank
Thank
Please,
you.
you.
please.
Nice day.
Thank
Jen,
you.
Thank you.
lovely, lovely, my dear,
Thank
to
you
see
all.
you again.
Okay. Bye-bye.
Thank you. Thank you. Bye. Thank
Thanks,
you.
Bye.
everyone.
Thank
Bye.
you.
We'll see
Bye.
you next time.